Everybody that I see in current practice seems to have reflux disease. Is it because we're diagnosing better? Is it because we've got other problems that leads to reflux? What's the problem?
I think it's actually a combination of a lot of different factors. I think there is some truth to the fact that we're looking harder. I think patient realization for risks related to reflux has led them to come see the doctor more often. That's part of it, but I also believe that it has something to do with what we are doing as a society. I think because of the obesity epidemic in this country and because perhaps we're consuming more coffee, that we're seeing behavioral habits that promote reflux more commonly in people.
So if somebody's overweight, that puts a big belly, puts pressure on the stomach, and it pushes it back away. Pregnancy do that too?
Pregnancy can, and it's interesting that in pregnancy you can actually have reflux during any of the trimesters, but it's most commonly seen in the first trimester and probably has a combination of not only pressure in the abdomen but also hormonal influences from the new baby.
So what does coffee do with that? It just increases acid, or to do something to the sphincter? And how about cigarette smoking?
So with coffee, the caffeine has been scientifically shown to reduce the tone of the sphincter muscle at the bottom of the esophagus, and that's probably the main mechanism by which caffeine and coffee then promote reflux. With cigarette smoking, it's the nicotine in cigarettes that seems to promote reflux by virtue of the same mechanism, basically relaxing the tone in that sphincter muscle and allowing it to stay open for longer periods of time.
So there's lots of scientific reasons that we're having now that acid from the stomach can reflux up.